Welcome back to the Poultry Doc Podcast. I'm your host, Dr. Blayne. Today we're at Napa Farm to check out Teddy, a hen with dramatic swelling around her eye that turns out to be much more than a simple infection. As we express the abscess, I'll talk about respiratory disease and real-world flock management. If you find these videos helpful, peck that like button and subscribe to the channel. Let's dive in. I pull into Napa Farm just east of Austin, and before I can even step out of the truck, I can hear chickens. 400 acres, a farmer's market, and nearly 10,000 fruit trees going in. It's a beautiful place to keep birds, and today I'm here to see Amory and her hen Teddy. When I pick up Teddy, I can already hear it. The faint, wet gurgle in her breathing, subtle but unmistakable. Her right eye is swollen and there's a firmness beneath the tissue that tells me this isn't just simple irritation, it's respiratory disease, and has likely been persisting for some time now. The backstory unfolds exactly the way so many backyard flock cases do. New birds brought in, no quarantine, stress removing, and then the slow burn of illness through the flock. 42 pullets added to an established group, a lesson Amory tells us she learned the hard way. Now we're dealing with what is very likely Mycoplasma, a disease that doesn't politely leave once it arrives. If this is Mycoplasma gallisepticum, it's vertically transmitted, passed from hen to chick through the egg. That's the part most people don't realize. You can separate birds, you can hatch chicks away from the main flock, but if the breeding stock carries it, the chicks likely will too. They'll mount an immune response, and the disease will wax and wane, but it never truly clears. And that's the management conversation. Not eradication, but mitigation. Teddy's breathing tells me the upper airway is involved, but with birds, upper and lower aren't quite like in mammals. Bird lungs don't expand and contract like ours. They're fixed structures, air sacs, thin-walled bellows throughout the abdominal cavity, stretching even into the bones of the wing, move air instead. Every breath passes through the lungs twice. It's an extraordinarily efficient system, an evolutionary remnant of their flying ancestors. It's also a system that, when inflamed, spreads infection efficiently, too. The swelling beneath her eye feels dense. That's another difference people don't expect. Birds don't make liquid pus like mammals. They wall off infection. Their immune response creates thick, caseous material, almost cheese-like, yellow, firm, inspissated. If her body can push it toward the surface, it will. If not, I have to help. We clean the area first, blood on the feathers from flock mates pecking, because chickens will always investigate weakness. No local anesthetic today. The lesion sits too close to the eye. I don't want to cause accidental trauma. The swelling is already near the surface. A tiny incision is enough. Normally, I'd use a larger gauge needle. It cuts better, but today I work with what's in hand. A small opening, gentle pressure. Thick material begins to express. More solid than fluid, exactly what I expected. We remove as much as possible, and I explain why we'll swab for mycoplasma. Abscesses like this are often secondary bacterial infections, sometimes staph, sometimes opportunistic invaders that took advantage of inflamed tissue. Any small break in the skin, even microscopic, can seed bacteria. Staph lives normally on the skin. It doesn't need much invitation. We flush thoroughly, chlorhexidine inside the cavity, because I'm irrigating deeper tissue, and ensure all caseous debris is removed. Bleeding starts, and that's good. Blood means circulation. Circulation means immune cells, antibodies, healing capacity. An abscess cavity that doesn't bleed worries me far more than one that does. The swelling temporarily increases. That's manipulation and inflammation, but the mechanical pressure source is gone now. Still, I can feel something deeper. Possibly infection extending toward the bone, possibly chronic change that won't resolve with one treatment. This may not be a one-and-done fix. It may take repeated debridement. That's the reality with chronic sinus infections in poultry. We talk about infectious coryza too, because the symptoms can look similar: facial swelling, discharge, flock-wide depression. But coryza tends to hit hard and fast. Quiet flocks, rapid spread, dramatic infraorbital swelling. You can't diagnose either one by appearance alone. Testing matters, and ethics matter too. Mycoplasma-positive flocks shouldn't be sold into naive populations. It's a difficult conversation, but it's an important one. By the end, Teddy is calmer, the airway is still noisy, but the pressure relieved. The cavity is clean, the plan clear. I thank Amory and Napa Farms for having us out. It's a beautiful farm, just past the airport, headed east off 71 towards Bastrop. Come by for fresh eggs, pickles, and coming soon, an orchard where you can pick your own fruit. It's an amazing place, and Amory is taking amazing care of her flock. Till next time, this is Dr. Blayne. Thanks for joining. Peck that like button and subscribe if you want to learn more. Stay curious.